Well, good morning. My name is Genesis Rivera Martinez. I'm a microbiology student at the Guam, Carolina, and I represent the Student Association of the American Medical Student Association, also known as ANSA, in Guam, Carolina. Right now, I would like to introduce Dr. Cinthya Tifft, who is Program Director of the NIH Medical Genetics and Genomic Medicine Residency Program. Dr. Tifft earned a PhD on genetics from the University of Texas Graduate School of Biomedical Science at MD Anderson Cancer Center and has an MD from the University of Texas Health Science Center in Houston. This morning, Dr. Tifft will present us information on how to become a medical geneticist. So without further ado, we welcome Dr. Cinthya Tifft.
So how to become a medical geneticist. I'm going to give you some information about how to become a medical geneticist, and then I would like to end by telling a portion of my story of how I became a medical geneticist. So do you like solving mysteries? Do you like science? Do you like to teach other people? Do you like to work as part of a team? Do you aspire to help other people? If the answers to those questions are yes, medical genetics may be your calling. So when you hear the word genetics, what comes to your mind? When I was an undergraduate student like you are, when I heard genetics, I heard Mendel's P crosses, I heard Punnett squares, I worked with fruit flies. Not exactly the most exciting thing. I will be honest with you, my very first genetics course, I got a D for a grade. I had to retake the entire course. Never thought I would become a geneticist. But genetics is a lot more than just P crosses, Punnett squares, and fruit flies. Genetics actually impacts all of us. It determines who we are, who we might become, what diseases we might be at risk for, and even how long we might live. All of this obviously is programmed into our DNA. So what does a medical geneticist do? A medical geneticist provides a diagnostic workup for rare and inherited conditions in children, in adults, and sometimes both, using cutting-edge diagnostic and molecular testing. And we are adding new types of testing and molecular testing every year. A medical geneticist provides evaluations for hereditary cancer syndromes, risk assessments for families, and if you're a family that's known to be at risk for a particular cancer syndrome, we'll set out a plan for you to how to undergo surveillance to make sure that those cancers don't happen. Medical geneticists treat patients with genetic disorders. They sometimes participate in clinical research to develop new therapies like gene therapy, enzyme replacement therapy, or gene editing therapies. So what do you have to do to become a medical geneticist? Medical geneticists are physicians, and they specialize in inherited disorders. And there are thousands of inherited disorders. So after medical school, most geneticists train either as pediatricians, internal medicine doctors, or OBGYNs, but that's not true for all of them. In our training program, we have had pathologists, we have had ophthalmologists, eye doctors, and right now one of our trainees is a specialist in fetal and children's heart disease. So it's common to be a pediatrician, an internist, or an OBGYN, but you don't have to be. You can be anything. So after you complete your primary residency, medical geneticists also complete another 2 years of training in medical genetics in order to, what we say, sit for the board exams, to be trained as a medical geneticist. So if you're thinking about this and you're thinking that this might be an exciting career, what might a medical geneticist do in a typical week? And some of this is from my own experience. Obviously, we each have our own experiences, but maybe 1 or 2 days a week, you might see new patients, You would take a family history, perform a physical exam. We sometimes call this a dysmorphology exam. In other words, we're looking at things that are unusual about that particular child or adult that make them not quite fit into the family. And then you would order diagnostic testing and in order to make a diagnosis or to confirm a diagnosis that you suspect. You might spend 1 day a week doing consultations in the hospital, in the newborn nursery, or in other places in the hospital where other physicians have said, you know, I think there's more going on here. Maybe this person has a genetic disease. And then they would call you and say, please look at my patient, see what you think. You might spend a day managing a really sick, acutely ill patient with a known metabolic disorder, like maple syrup urine disease. And yes, that's a thing. Along with your ICU, your intensive care colleagues, this children get very sick. You might meet with a family who has had a positive newborn screen in their infant. This is the newborn screen is the test where they draw blood from the baby's heel and put it on the little circles and send it off to a laboratory looking for what we call inborn errors of metabolism. You might spend a day or 20% of your time reading and researching about newly described diseases or working in a clinical laboratory, interpreting laboratory results. Genetics is a rapidly advancing field, and there are new diseases, genetic diseases being discovered that come out in journals every week, every month. So it's exciting because it's never the same. So what might a geneticist do in a typical month? They might, as we say, see new patients or see their patients back in follow-up. They might refer their patients to other subspecialists. This is really what we call a medical home. The geneticist might become the medical home for the patient who has lots of different needs in lots of different organ systems. Let's say heart or kidney or development or neurology. And you might be the person that actually kind of oversees all of those evaluations for that particular patient. So you would be their medical home. You might participate in a clinic with other specialists that treat patients with a particular type of genetic disorder, like a skeletal dysplasia or craniofacial disorder. When I was a large part of my career, I co-directed a craniofacial clinic. As you can see here on the right, a child with a cleft lip. The craniofacial clinic saw all kinds of children with facial differences. And as you can imagine, there are lots of different things that impact a child with a facial difference. If you have a cleft lip or a cleft palate, yes, you need a plastic surgeon to fix that. But you also need a speech therapist to help you speak clearly. You need a dentist because your teeth you're coming crooked a lot of the time. You need a psychologist. You might need, an eye doctor. So everyone would be part of that clinic, and you as the geneticist would also oversee that particular specialty. You might serve as the attending physician on ward service, and that would involve teaching residents, teaching medical students. So if you like to teach, this would be the place to do that. You might give lectures in medical genetics, because remember I told you that this is a rapidly advancing field, which makes it exciting. There is no boring day in medical genetics. So what might you do in a typical year? You might diagnose or manage 500 to 800 patients in a year. Seems like a lot, but actually it's not that much compared to what, for example, a typical pediatrician might do, because you would be spending more time with your patients to get to know them, to manage their different conditions. You might travel to national, international meetings to present new findings or learn new things and network with your colleagues. You might participate in a treatment trial for a rare disease. You might publish reports of new or ultra rare diseases in a journal like the American Journal of Human Genetics or Genetics in Medicine. You could also become an advisor to a patient, what we call a patient advocacy group for a disease of interest. For example, my diseases of interest are Tay-Sachs disease, which is a fatal neurodegenerative disease, and another disease called GM1 gangliosidosis, which is very similar to Tay-Sachs, and NTSAD, the National Tay-Sachs and Allied Diseases Association, is a group of families who have children and adults affected with those things. I've been on their advisory board for more than 20 years. So you may have some special interest in a disease that really interests you. There are lots of different ways to train in genetics at the NIH, and there are more than 50 different programs in the United States to train in genetics. The clinical genetics training programs that are for physicians come in various flavors. The most common would be to do a 2-year training in medical genetics after you finished a primary care residency. But if you know you want to do genetics, you can also go straight to a residency program in pediatrics and medical genetics, so that in 4 years you can actually be trained in both. You could also, if you were an OBGYN, you might be interested in maternal fetal medicine. So you could do a fellowship in maternal fetal medicine and medical genetics. Same is true for reproductive endocrinology. If your interest was in helping families have healthy children, that might be another avenue for you. And then some of our medical genetics residents also do extra training in biochemical genetics. If you like biochemistry and you like metabolic pathways and you sit in front of your metabolic chart like I did when I was an undergraduate, memorizing my metabolic pathways for glycolysis and fatty acid oxidation, and you're smiling, I can tell this because you've done this. Any of you who are in science, you can do extra training in medical biochemical genetics. And then if you are not interested in really going to medical school, but you are interested in training more in research, you can become a PhD, and you can also train in laboratory programs for genetics. We have a clinical biochemical genetics fellowship where you learn to run a biochemical genetics lab and become the lab director. Or the Laboratory of Genetics and Genomics Fellowship would help you to become a director of a laboratory for chromosome analysis and other genomic types of analysis. So there are lots of ways to do this at the NIH and in many other programs. So the training for a physician in medical genetics involves training in a number of different areas over about an 18-month period. You do a number of different rotations: adult, pediatric, cancer, neurogenetics, dysmorphology, cytogenetics, many different things. Plus, as you go through the 18 months, you keep a logbook of all the cases that you've seen. And in order to sit for the board exams, you present your logbook with all the different cases that you've seen. So you're basically telling them, yes, I've trained in a very broad group of genetic conditions. So let me tell you a little bit about my story. It's a little convoluted, took a while. I was an undergraduate student at the University of California at San Diego. I knew I wanted to go to medical school, but it was hard to go to medical school at that point, and I was a good student, but not a great student. So I decided to go to Rutgers University and pursue a master's degree in genetic counseling. And during that time, I applied to medical school. I can tell you I was rejected from medical school more than 20 times, so don't get discouraged. I finally ended up going to graduate school, as Geneticist said, at the University of Texas in Houston, and then stayed for medical school. So I was there, the better part of 10 years. I started my residency in Houston and finished it at Johns Hopkins Hospital. You can see the dome over here on the right. And by that time, because I had gone to NIH as a medical student and done an elective in genetics, I knew that's what I wanted to do, and I knew I wanted to do it at NIH. So I went to the NIH for 4 years to do a fellowship, and then finally, my father could not believe that it took that long. I was ready to get a faculty position and actually practice medical genetics. So I went to Children's National Medical Center, we say the nation's children's hospital, and I spent 18 years there. 12 of those years I was running the Department of Genetics, and I did many of the things that I explained to you in the slides about the day, the month, and the year. A real diversity of things. And then finally, about 11 years ago, I was given the opportunity to return to NIH, and this time to NHGRI, with a way to help desperate families with undiagnosed diseases and fatal neurologic disorders. So part of my job, besides running the training program, is to see patients, children, who have diseases that no one's been able to figure out, that no one has been able to diagnose, and we try to diagnose them using very sophisticated genetic techniques. And I also take care of children with the fatal neurologic disorder I mentioned to you called GM1 gangliosidosis. Now, did I know this is exactly how things were going to work out when I was an undergraduate? Of course not. But I seem to sort of get on a path and just kind of keep moving. You never know where life is going to take you, and you have a lot of years to live. You need to do something that you think is going to be fulfilling and help out the world. Louis already showed you a picture down in the bottom right here of the NIH Clinical Center, which is where I spend my time now. And I will tell you one example of being able to follow your dreams. May 8th last year, 2019, we were able to do probably one of the most exciting things a physician gets to do in their career, which is to be part of or to run a clinical trial where you're giving a medicine that is the first time it's ever been given to a human being. This, in our case, was a gene therapy trial for children with GM1 gangliosidosis. You can see the little girl here, 10-year-old Jolene, who was our first patient. This is my team. This is her mom. This is the rest of my team. And this was, you can actually go and read this story. If you go on the NHGRI website, you can actually read the story about how we did this, and it will tell you about why we call this a tea party. But I tell my students and colleagues this was the most exciting but the scariest day of my life, because we didn't know what was going to happen when we gave this medicine. Well, it turns out she's now almost 18 months from this treatment, and she actually has been able to show some improvement, which is what a clinical trial is designed to do. We don't know how long that's going to last. That's why it's research. But we've actually, even during this COVID epidemic, gone on to treat another 6 patients. And so the clinical trial is well in process. And in a couple of years, we'll actually know whether or not this is helpful. So this has been kind of the culmination of my career, but it was a career that really was exciting all the way along, with being able to help patients and take care of patients in a field that was always advancing and really exciting. So I would be happy to answer any of your questions, either on the chat or right now.
Okay, we have Genesis Rivera.
Hi, Dr. Tifft. First things first, excellent presentation. Thank you very much. And my question actually is, what would you recommend for someone who is really interested in continuing to study this area, particularly in a medical stage? You know, what would you recommend, or what would you say you would have to particularly like in order to become a medical geneticist?
Well, if you're in medical school already, is that what you're talking about? If you're already in medical school?
Or in medical school, or maybe before, a little before.
Okay, so if you're interested in science, if you're an undergraduate and you would like to go to medical school, you can either, depending on how good your grades are and your recommendations, you can apply directly. And then in the last 2 years of your training, usually you have some elective time where you can choose to do something that interests you. Most medical schools have, we call electives, usually 4 weeks or so in genetics, that you would go with a geneticist in that medical school and learn and begin to see patients and see whether this is something you'd really like to do. If your school does not have a medical geneticist, it is certainly possible, with permission of your school, to go to a different campus and spend time with a medical geneticist. We actually have at the NIH a program for 4th-year medical students to come to the NIH, and I direct that program. So you could come for 4 weeks, 6 weeks, 8 weeks to the NHGRI, to the Genome Institute, and see patients on our protocols. So those are some of the options. And then you would go take your, do your residency and come back to medical genetics. Now, if you were undergraduate and you weren't quite ready to apply to medical school, I think Luis mentioned, but we have at the NIH what we call the post-bac ERTA program, where you could actually apply to come and work in a research lab or work in the clinic with investigators for 1 to 2 years, sort of as a transition before you apply to medical school. So that's another option for you.
Thank you.
We have Nelida Pietri.
Good morning.
Good morning.
I got a question for Dr. Tifft. Congratulations.
Thank you.
It's beautiful story. My question is about the Geneticist doctor is prepared in 2 years. If a nurse will be interested in continuing studies in the branch, how long will it take and what will her participation be based on in the care of patients?
You know, as far as I know, there is not a formal program in genetics for nurses. However, there are nurses who do, many of mine are my research nurses, their interest is in genetics. And they kind of learn it on the job, I would say. You could, become a nurse in a genetics clinic and begin to learn. There is an organization called ISONG, International Society of Nurses in Genetics, that is kind of a group of nurses, all of whom are very interested in genetics. But I don't know right now of any formal program in nursing to become a nurse geneticist, for example. But you can certainly specialize.
Thank you for your response.
You're welcome. Good luck.
Thank you.
Okay, one last quick question. Andrea Maisonet.
Hi, I wanted to ask, what can you say to students from Puerto Rico that do not speak Spanish but want to be part of different NIH programs in the US?
That do not speak Spanish?
I'm sorry, do not speak English.
Maybe some of the programs Luis was talking about where you can actually do your research in Puerto Rico, but be paid, have it paid for by the NIH and then would come and present your work. There are many Spanish speaking folks at the NIH, and I'm kind of thinking outside the box here. Perhaps it would be possible to go as a post-bac ERTA to the laboratory of an investigator who spoke Spanish and work in the laboratory in that way, possibly. I'm not completely sure about that though, but thank you for your question.
Thank you.
Thank you, Dr. Tifft. Very inspiring your story.
Now, how can I get my screen off here?
I guess you will see next. Okay,
Okay.
Perfect.
Thank you.
Thank you. Okay, now we have Kiara Matos.